what it means to be a boy or a girl. They learn it from their parents, or rather older children and anyone surrounding them. Now, their learning process begins very early. Now, it's the doctor or any other healthcare provider who actually declares the sex of the child. Now, to identify as a gender that is different than the one they were assigned at birth is what we all come across as the transgender community. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and I'm going to discuss about the deterioration of mental health in transgenders and their increase in suicidal thoughts as well as attempts. Suicide is the second leading cause of death in adolescents and young adults aged 15 to 24 years. Sexual minority youth, those attracted to the same gender or multiple genders or who identify themselves as lesbians, gay, bisexual or even queers are also at an increased risk of mental health issues. They also can lead to suicidal thoughts or ideations and even suicidal attempts. According to a new research published in the Canadian Medical Association Journal, transgender and non-binary teens are at higher risk of suicidal thoughts and attempts than their cisgender peers. The transition from adolescence to adulthood is a very stressful time for all the young people, but particularly for gender and sexual minority teens. These findings showing dramatic increases in suicidal risks should sound a clarion call that additional support is definitely needed. As the risk of thoughts of suicide and attempts is not well studied in the transgender community as well as the non-binary youth, researchers analyzed data from 6,800 adolescents aged 15 to 17 years, 99.4% of whom were cisgender, meaning they identify as the gender they were assigned at birth, and 0.6% were transgenders, meaning they identify as a gender that is different from that they were assigned at birth. The majority, accounting for about 78.6% of the respondents, were heterosexual, 14.7% were attracted to multiple genders, 4.3% were unsure of their attraction, 1.6% were girls attracted to girls, and 0.8% were boys attracted to boys. Overall, 14% of the teens experienced suicidal ideation within the previous year and 6.8% had previously even attempted suicide. Transgender youth were 5 times more likely to think about suicide and 7.6 times more likely to have ever attempted suicide than their cisgender youth counterparts. The researchers hence concluded that suicide prevention programs specifically targeted to transgender community, non-binary and sexual minority adolescents as well as gender-affirming care for such adolescents may help reduce the burden of suicidability among this particular group. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.